If you've been given a diagnosis of early-stage breast cancer, you might be wondering, what does this mean? What's next? And should I be worried? Let's talk about early-stage breast cancer. Cancer, by its nature, is a group of abnormal cells that divide and grow in an uncontrolled way, usually forming a tumor, and can invade surrounding tissue. Cancer, including breast cancer, comes in 5 stages, 0 through 4. Stage 0 is considered the earliest stage of breast cancer. Some experts call it precancerous. This cancer is currently not invasive, meaning it's limited to one area and has not spread to other parts of the body. Stage 0 breast cancer comes in 2 forms. One is more rare. It's called non-invasive Paget's. It's found in the nipple. The other is much more common. It's called ductal carcinoma in situ, or DCIS, and it's what most people mean when they say they have early-stage breast cancer. According to the American Cancer Society, there will be 56,500 new cases of DCIS in 2024. With DCIS, the abnormal cells are limited to the milk ducts and have not gone through the duct wall into the fatty tissue of the breast, which makes it easier to treat successfully. The good news is that nearly all women with this early stage of breast cancer can be cured. With early-stage breast cancer, you have a number of treatment options. One is a lumpectomy. In a lumpectomy, the area of the breast with the abnormal cells is removed, along with some of the surrounding tissue. This is a breast-conserving surgery. Often radiation is recommended as a follow-up. Another option is a simple mastectomy, where the entire breast is taken. Both are equally effective at destroying the cancer cells and reducing the risk of the breast cancer coming back in the future. When making important decisions about your health and healthcare, it's important to talk frankly and openly with your doctor. He or she can help arm you with what you need to make the most informed decision for yourself. Don't be afraid to ask hard questions. And consider bringing a friend or family member to your appointment, as it can feel overwhelming to get a breast cancer diagnosis. It's a lot to take in. You can also get a second opinion to give you peace of mind about your original diagnosis. If you haven't been diagnosed with early-stage breast cancer, but you're concerned because you've discovered a lump in your breast or under your armpit during a self-exam, or had bloody discharge from your nipple, speak to your doctor and get tested. Breast cancer most often presents in middle-aged and older women. If you're of average risk, meaning you have no personal or family history of breast cancer, you can start getting yearly mammograms, a low-dose X-ray of the breasts, as early as 40, but definitely by the age of 45. At 55, you can opt to go every other year. Women who are at high risk are recommended to begin screening at age 30. Breast cancer can present with no symptoms at all. That's why it's important to keep up with your annual screenings. If you've recently noticed a change in the size or shape of your breast, or if there's been a change in the skin texture of your breasts, like it's more red, irritated, flaky, discolored, or dimpled, or if your nipple has become inverted, these are all possible symptoms of breast cancer. Get familiar with your breasts so you can tell if there are any changes. Please note that many of these changes can be caused by benign or non-cancerous breast conditions. Be sure to report any changes to your doctor when you notice them. The sooner you get tested, the better. Learning the results can allay your fears or can give you a head start at treatment. When it comes to treating early-stage breast cancer, catching it while it's small and before it spreads are the 2 most important factors that lead to a positive prognosis.